Meet Alex, a 32-year-old marathon enthusiast who believes joint pain is only for the elderly. Despite running 50 kilometers weekly, Alex dismisses minor knee stiffness as normal fatigue. Studies show 1 in 3 adults under 40 experience early joint wear due to high-impact activities, yet 70% ignore symptoms until severe damage occurs. This is the invisible start of degenerative arthritis. Post-run, Alex massages a tender knee but chalks it up to good pain. Research reveals this dull ache signals micro-tears in cartilage. Unlike muscles, cartilage lacks blood supply, making self-repair impossible. Shockingly, MRI scans show 40% of asymptomatic adults already have cartilage lesions. Early intervention could prevent 80% of future joint replacements. Dr. Lee points to Alex's X-ray showing early cartilage thinning, recommending reduced mileage and glucosamine supplements. But Alex scrolls past the advice, reflecting how 60% of patients ignore initial medical warnings. Orthopedic studies confirm cartilage wears 3 times faster in runners versus swimmers. Prevention now could delay arthritis onset by 15 to 20 years. Alex's lifestyle is a perfect storm for joints: marathon training, high heels at work, and heavy backpack commuting. Biomechanics show high heels increase knee pressure by 26%, while backpacks over 10% body weight accelerate disc degeneration. Even smartphone overuse strains cervical joints. These cumulative microtraumas trigger silent inflammation. The truth emerges in an MRI scan: synovitis, joint lining inflammation, and grade 2 cartilage loss. Healthy cartilage appears pearly white on scans. Alex's shows gray fissures. Surprisingly, inflammation persists even without pain due to poor nerve supply in joints. This silent phase lasts 5 to 7 years before crippling symptoms appear. Jamie, Alex's cycling buddy of the same age, shows pristine joints thanks to prevention, low-impact cycling, collagen supplements, and annual checkups. Dana shows cycling reduces arthritis risk by 43% versus running. Jamie's DEXA scan reveals 15% higher bone density too. This stark difference proves early care prevents 78% of sports-related joint degeneration. Disaster strikes when Alex's knee locks mid-staircase, a hallmark of advanced arthritis where cartilage fragments jam joints. ER scans reveal bone-on-bone contact and meniscus tears. Shockingly, 90% of such acute episodes trace back to ignored early warnings. Surgery now becomes inevitable, with only 60% chance of full mobility recovery. Post-surgery rehab feels like torture. Electrode-stimulated quad contractions and painful flexibility drills. Research shows post-arthroscopy patients need 6 to 9 months to regain basic function. Alex learns the hard way that 1 hour of prevention equals 100 hours of rehabilitation. PTs reveal 80% of their patients could have avoided surgery with early care. Dr. Lee explains the biology. Cartilage matrix, collagen plus proteoglycans, starts degrading at age 25. By 35, collagen production drops 30%, while wear accelerates with impact sports. New studies show chondrocytes, cartilage cells, have limited replication capacity, like a printer running out of ink. Antioxidant-rich diets and proper loading can extend their lifespan by decades. Transformed Alex now swims and does Tai Chi, takes omega-3s, and uses ergonomic gear. Studies prove swimming rebuilds 18% cartilage thickness in 2 years. The final lesson: joints are like credit cards. Overuse brings future debt, while SART investments yield lifelong returns. This full-circle journey underscores that joint aging isn't about age, but accumulated choices.